Well, to me, one of the most important things is that a family and a patient are comfortable when they come in. The kids come in to see their doctor. They're always very nervous. They're always very anxious. I like to take a few minutes to try and get to know the patient a little bit. We're not primary care, so we don't have the luxury sometimes of having to know the family and spending time with them. We see them from time to time. We might see them a lot of new patients, but often what happens is they come in here and they're very anxious and they're very nervous, and as are the parents, because they think that there's something wrong. So I like to spend a few minutes trying to get to know the family, get to know the child, and once they're comfortable, I think it helps things quite a bit. Well, pediatrics is very unique in that we see patients from all different age ranges, from newborns and neonates all the way to adolescents and young adults. And the other thing is, kids are very sincere. When they're ill, it's very obvious, and when they're feeling better, that's also very obvious too. In our specialty, we see children with abdominal symptoms, children who don't grow well. We see moms who are often very anxious because their child won't feed well. In those situations, it's difficult enough being a parent, being a child, being an adolescent. And when they come in and they're uncomfortable and they're not doing well in school because they have an abdominal issue, and we make them feel better and they can get back to being a normal kid, that's very rewarding. And when a parent has a child who's not feeding well and not growing well, and that mother is very anxious and we can do something to help, it's an extremely rewarding field, and I feel very fortunate to be able to help in those situations. Well, in pediatric GI, we see a large variety of different patients, from newborns all the way to adolescents and young adults. In the newborn area, we see a lot of kids with feeding problems, with growth problems, with reflux problems, and stooling abnormalities. In adolescents, we'll see children with inflammatory bowel disease, such as Crohn's disease and colitis. We see kids with celiac disease, and we also see patients with pancreatic problems and liver problems as well. When patients come to see us here, first of all, it's a privilege to be able to take care of their children. And our top priority is the well-being of that child. And that's what we went to school for so many years for, and that's what we are trained to do, to take care of their child, and that's our top priority. I feel very fortunate to be able to do what I do. For a parent to trust me with the care of their child is very, very rewarding. To be able to have an impact on that child's life on a daily basis is one of the most rewarding things that I think that anyone can possibly do, and I feel very fortunate to be able to do that.